Hello, everyone. This is part B of our presentation this morning. I've removed my headset, and I'm not sure if that was what was causing everything to cut in and cut out. If you could just let me know if that was it, if my voice is sounding clear now. Oh, perfect. Thank you very much. Okay, so we talked about earlier on our recording, we talked about stages of shock. We talked about the 3 different types of shock, and we've now been just reviewing some of the medical surgical emergencies that you will see. And I'm going to go back to sharing my screen if I can find my PowerPoint again. Is that the PowerPoint I'm looking for? Let me just, during my troubleshooting, I closed everything, so now I just have to pull it all back up here. So it just will take me 1 second, and I appreciate your kind patience here. Just want to make sure I don't forget to tell you this, so I had to write it down. Okay, now just one other thing. I'll just pull up my PowerPoint here. Now, just about. There, I think we're good now. Thank you for that. Let's just share screen, and we'll get that back up. There we are. I think we're in business now. That's interesting. I've used this platform all over the world and have never had any problems with it. That's the first time. So go figure. And so what I wanted to talk to you about now is malignant hyperthermia. Malignant hyperthermia is a condition that occurs in a certain part of the population, and it occurs in pockets, although now it's becoming a bit more widespread. That we used to see locations. So for instance, up in King City, there was a pocket of malignant hyperthermia because of the strong genetic predisposition. Let me just grab this chat. Okay, I'll make sure you've got this. This is just merely a topic. There are PowerPoints about this, but I just wanted to highlight malignant hyperthermia. There are some in the file on malignant hyperthermia. But I do want to highlight that malignant hyperthermia is a genetic predisposition to a hypermetabolic state that occurs in the influence of anesthetic agents. So when a patient is under anesthetic, if they have the predisposition to malignant hyperthermia, they end up having this very fast, high temperature, this hyperpyrexia. The temperature can go up to 104, 105, 108. The patient becomes very gets very fevered, and then develops this muscle rigidity. It is this profound muscle rigidity that is a problem because it's hard to ventilate these patients. They can't get air or oxygen into the lungs and exhale because of this rigidity. And so what occurs, so nursing's role is to two things, is to first of all pack the patient in ice to help bring down the temperature. The other role of nursing is to mix up the medication that will help to relax the muscles and prevent this rigidity. And it is called, excuse me, it's called dantrolene. And so dantrolene will help to relax the muscle and allow the patient to be at least ventilated. This occurs in usually the inhalation type gases, but you'll also see this in agents, so they refer to them as neuroleptic agents that they might give to mental health, for mental health issues. You might see somebody that has this genetic predisposition react with this malignant hyperthermia. But generally it's in the presence of anesthetic type agents. So I just wanted to highlight that with you. And what was the other condition I wanted to, oh, wound dehiscence. So wound dehiscence is always a concern with any of our patients, and depending on how much surgery, how much, how friable their tissues are, etc. So you might go into someone's room and see their bowel protruding through part of their abdominal incision. It again is another medical emergency. You need to put moist saline gauze squares over the bowel so it doesn't get dried out, and call for the surgeon to take the patient back to the OR stat. So wound dehiscence, you want to cover that bowel, keep it moist with 4x4 or an abdominal pad, sterile abdominal pad, soaked in saline, and call the surgeon stat. So I just wanted to point that out to you. And stroke. Stroke, again, we've talked about it in cardiovascular, we did a little bit around neuro, but I just wanted to highlight again that there are stroke protocols. These stroke protocols are similar to the myocardial protocols, myocardial infarction protocols, in that the patient needs to be triaged to be diagnosed with whatever type of stroke they're experiencing. So if the patient all of a sudden has facial drooping or arm drooping or speech impairment, then you'd want to have this patient seen in the emergency department as soon as possible. There's about a 3 to 4.5 hour window that from the last time this patient was seen normal to the time that this patient has a CT scan to show that the patient is having an ischemic stroke and having a medication mixed up and administered. Very short window. So for an ischemic stroke, which is somebody who's got a blockage from plaque and maybe a bit of a blood clot, that the ischemic stroke, they want to give a clot-busting medication to dissolve that and allow blood to perfuse the brain. And so that is what we refer to as our stroke protocol. If the patient they have to do a CT scan to ensure the patient is not having a hemorrhagic stroke or a stroke that's caused because the blood pressure is so high and there's a tear in the artery and they now have blood flowing into their brain. Because if you gave the clot-busting medication, they would essentially die. They would just bleed into their brain. And so the patient is experiencing any kind of hemiparesis in their limbs or speech impediments, they're going to be then triaged in the emergency department very quickly, have a CT scan within 3 hours, and receive that clot-busting medication referred to as TPA within 4 hours. They call this, oftentimes the stroke is missed. So people go to bed at 10 o'clock, they're fine. When they wake up in the morning, they have facial drooping, they have heavy paresis, they have speech impediments, and their family says, well, they were fine when they went to bed. Well, 8 hours is way too long. And so it's really important that these patients are identified early. If the patient is experiencing, they talk about these classic stroke signs. They talk about face. So facial drooping. Is there any facial drooping? Is there any asymmetry of the mouth? That was one thing I missed as an early nurse, as a new nurse. I didn't realize that one bit of facial drooping was not just a crevice, but actually they had drooping in that side of their face. So look for symmetry of their mouth. So face, their arms. They should be able to hold their arms out. If they're having a stroke, they're going to have some drift of their arm, or they're not going to be able to hold up their arms. So get their arms to be held up and looking for any kind of drooping of their arms or weakness in their arms. So face, arms, as C stands, in speech. What does the C stand for? It's fact. Oh my gosh, it's speech, and then time. You need to get this patient to the emergency department as quickly as possible because they need to receive that treatment within that very short window of time. So just to be alert to patients experiencing a stroke. So some of the conditions that we've talked about this morning include malignant hyperthermia, myocardial infarction, respiratory arrest, wound dehiscence, and stroke. And so I just wanted to highlight that. Now, what I'd like to do now is, if first of all, I'd entertain any questions that you might have. So please use the chat feature if you have any questions about shock or about shock, let me stop share. About any of the conditions that we talked about, please forward those questions. Otherwise, I'd like to just do a quick summary of the course, so to help target your studying for January the 20th. I see a question here. Will you be posting this PowerPoint? I can post, sure, absolutely, that won't be a problem. This PowerPoint is actually posted as probably under a different title. It's a purple PowerPoint. It's all about the different conditions. It should be already there, but I'll make sure if it's not. I know it was there when I checked initially when I was opening up the courses for you, so you had it. But again, I can give you any information. The thing is that I don't want you to become information overloaded. And so through these video recordings, I have tried to drill down what's important. And so what I'm wondering is, how can I help you prepare for the final exam? So I've got 4 or 5 people online, and I just appreciate you being there. How would be best for me to help you prepare for the exam? Because, you know, I did promise you in the beginning of the semester that you were going to pull off great grades. And so is there practice exam questions? Yes, Sarah, that's a really good question. I remember at the beginning of the semester, I would post a midweek summary and there would be exam questions there. Someone asked me last session for exam questions and asked, and I said, for sure, follow up, fire me off an email and I will send practice exam questions for sure. I have exam questions for every one of these sessions. There's about 5 questions. And so I'd be glad to send those. And I think that's a really good way, a good strategy. You're beyond the reading, you're beyond the memorizing. And in fact, we were having a discussion with faculty this week about how we don't want you memorizing. We want you to know where to retrieve this information. Yeah, so could you email me and I'll be glad to share those for sure. Okay. Anything else? So Sarah wants exam questions. What does anybody else want online? What would help you to prepare? And so a couple things I want you to do. So I know you can read. When you're reading those chapters, as I mentioned, read for knowledge. So what is it that I need to take away from this chapter? And remember, I could have a short answer, although I have to say, Anisha, that short answer questions are really redundant. Any one of those multiple choice questions, you just cover up the answers and you can make your own short answer. There's no short answers on my exams, nor is there short answer on the NCLEX exam. And so I tend not to use the short answers. But I mean, just cover up the multiple choice answers and you can make those short answer questions. So describe nursing priorities for malignant hyperthermia. And then I would have prepare the dantrolene, notify the family, call for the malignant hyperthermia cart, or maintain the airway. Well, airway trumps everything, so it would be maintaining the airway. And then you could just cover up those multiple choice questions and ask yourself. Okay, but I'd be glad to do that. Anything else that would help you prepare for this? Short summaries of the important features of each week's lectures like you did at the beginning of the semester. Okay, so I kind of have done that. And so I can certainly do that as well, do those summaries. Can you just email me? You know how I have to remember. I have a short memory. But I will definitely do that. Anything else that would be helpful? So I will do those short summaries for sure. Anything else? Couple more people. Okay, so that's the other thing I was just wondering, and I know this is really, I've been struggling with this, and I'm just wondering, because there is a lot of information, would it be helpful if you were able to use a memory aid or a cue card? And so, okay, so I see 2 people have agreed, 3, okay. And so I'm thinking a small index card, 3x5. And remember that everything I do has evidence to it. And I was researching this morning, what's the best way to help students? And this is one way of helping reduce anxiety around the exam process. So I would be willing to allow you to have a 3x5 index card, a 4x6, 4x6. Okay. I'm going to try a 4x6 this time. I'll pilot it. You can have a 4x6 index card. And so would that be one-sided? Is that how they did it for farm? Was it 4x6 one-sided? Did both. Okay. Okay. Now I have to say that how I would approach it if I was you, I would do my studying. I would have concept maps like we did at the beginning of the semester, concept maps for every one of those sections, and have those concept maps. And then I would study them, and those things that you aren't able to remember from those concept maps, that's what I put on your index card. I wouldn't try to put every single thing on the index card, but they're your index cards. I will expect that your name would be put on it and that it would be submitted with your exam. The index card would be submitted with your exam. You did, so 4x6 both sides for finals. Yes. Okay, that's fine. That will be fine. But remember, this is a timed exam, and the exam is calibrated at 1.5 minutes per question. So you really have to know where the information is, and that's just your buffer should you be tired. Okay, so 4x6 index cards for the final. I'm going to see how it goes, and I wish you all the best of luck. I will do summaries like you wanted, and I'll provide questions. Okay? Anything else for me this morning? Is there anything else that you need any kind of information about? Is there anything else that I can help you with? Please don't hesitate to contact me. As I said, I really am here to support you. I know that this has been a very rough semester on you, and I just want to commend you all for being so professional. And that's really that's a real testament to the students in our program, the upcoming RNs of the future, that you are demonstrating such professionalism, and that is really appreciated and very much noticed. So I would also put that into your evaluations for clinical, that you demonstrate professionalism both in the classroom, both in clinical and outside of the clinical environment. So it's that piece about professional comportment. Okay, question about clinical, go ahead.
Can you hear me, Leslie?
Yes, I can. Go ahead.
Okay, I thought maybe I'll talk to you instead of typing. It's quicker.
Yeah, go ahead.
Now, since our clinical has been pushed after April. We were notified that it's going to be through a condensed period. Do you have any information regarding that? Because I'm planning to work. So I would like to know how long they're planning to run this weeks that we missed.
I am so sorry. I wish I had that information for you. Just like I wish I had that information for my bridging students as well. I do not. I am so sorry. And so I would actually, but it's not only just that you have to, people have a rent to the end of April. They've got their accommodations at the end of April. So how, they need to know how much longer to keep their accommodations. They need to know about daycare. They need to know about their work. And so I would really contact Dr. McCabe about that information so that you can get that to you as quickly as possible, because you need to make those arrangements. And so I am so sorry, I don't have that information. And I can only sympathize. I know I'm the same way. I need, because I have a clinical group starting in May, so I need to know when the clinical is so that I can have my clinical group going in after you folks go in. So there's a lot of logistics to work out, but I would definitely get in touch with Dr. McCabe. And could I just ask somebody, Nusha, I'm going to ask you if you wouldn't mind just letting me know when you receive notification about the arrangement so that we can have a double-pronged approach. I'll be pushing it this side, you can be pushing, you know, trying to get the information from your side, and we'll see if we can't get something to you. I totally know that you need that information. So that would, for sure. Is there anything else that I can help you with? Then I would just like to sign off here and thank you once again for your patience as we make these course recovery plans. I am there to support your learning in any way I can, and it's been my absolute pleasure to get to know you. I will meet you again in fourth year when we go all over this for synthesis, and I'm hoping that you remember at least half of it when we get to synthesis. I wish you all the very best in the upcoming semester, and please don't ever be, you know, drop into my office, fire me off an email, let me know when you're around so we can have a connection. When will we get our group project? I have to honestly say, class went till 5 o'clock for me on Friday, as it did for you. The holidays were, unfortunately, I had some family member at Sick Kids for the holidays, so I spent the time down at Sick Kids and did not get them marked. They will be uploaded by, I want to say, I'm hoping by January the 20th, so that you'll have some idea. But again, remember that the marks, I could have had them submitted December the 6th, and then before the exam period, but we waited till after to give you time and a bit of a breather. So I'll have to get at those, but I'm also starting my full semester next week, as you are. Oh, that reminds me. Math tests, will be doing orientation. And so you'll be writing, we didn't write it this week, but you'll be writing your math test during orientation for Professor Fabi, and that group will be writing it during our orientation as well. So I wish I had more information about the marks, but unfortunately I don't just yet. But I'll get them as soon as I can. All right, everyone. Thanks so much. Very best of luck. And we will chat soon. Bye now.